Oh, hi, friends. For all the people that were jealous of my beautiful teeth before I got sick, I aborted my AGGA braces after 2.5 years because it didn't really grow my jaw the way that it claimed to. So I am of the belief now that the only thing the appliance did was push my teeth outside of the alveolar bone and has given me root reabsorption. Let me fix this. And basically increase the chances of my teeth, of losing my teeth, because instead of growing the actual bone, it's moving the teeth outwards. And I am now in a lawsuit, sort of like a class action lawsuit against the manufacturer and the trainers. My goal will be to stop using this appliance. The FDA, ideally, the FDA would no longer allow the use of this appliance. So I am letting my teeth relapse as much as possible, and then I have some orthodontists and periodontists and surgeons that I will be consulting with after neurosurgery. On February 24th, I will have C0, C1, and C2 fused. That means basically 2 screws in each of the 3 vertebrae and then a metal plate to hold up my brain. So I've been trying to see these doctors for a very long time, trying to figure out who the right doctor is. And I found the Chiari EDS Center. I have a surgeon. The director of the center is the one that accepted me. And they also have a mast cell doctor who focuses on the histamine issues and my connective tissue disorder that was inherited. It's really interesting because she can look at my medical history and understand that as a baby, all of those ear infections that required so many antibiotics were actually the connective tissue disorder and the respiratory issues. She came to that conclusion without me even having to tell her all of my sleep apnea story, and I feel really comfortable with them. So in the beginning of December, I went down to Mount Sinai and we did a traction test, putting 2 bolts and using a pulley system to see how stretching out my spine would impact my symptoms. It really helped. It's amazing to see some of the changes as they increased the amount of pressure. It went up to 35 pounds. And then they stuck a sort of AV cable looking thing into my brain and measured my spinal pressure from laying down, sitting, and standing. That was only supposed to be a 1-night stay, and I wound up in the hospital for about 6 days because the results were too extreme. They wouldn't let me leave until they tried to do a blood patch, a high volume, somewhere that I can't remember. They took about 30 cc's of blood from my arm, mixed it with a clotting agent, and put it into my spine to try and prevent my spinal fluid from leaking so much. Did not work that great. The symptoms weren't worth it, basically. And what we're thinking now, because this is, again, it's rare, it's somewhat novel. My surgeon has been working on this for 20 years, but it took him a long time to convince other neurosurgeons and to get the funding and the data for all of this stuff. So, it's a little risky to have this done, but there's an 85% chance that my quality of life will increase any amount, and I would be happy. And uh, excuse me, I've been doing physical therapy 5 times a week to try and support above and below where the fusion will be, to decrease the likelihood that I will have sort of a domino effect and need surgery further down my spine later on. And of course, recovery, helping me with recovery. So I am all sorts of out of it. And I still can't remember exactly what I was going to say about it. But anyway, so I'm having this big surgery. I do have some airway related doctors in line for after I recover from the neurosurgery to talk about restorative orthodontics. Some of them believe that I might still need jaw surgery after all of this because, again, the AGGA appliance was supposed to be growing my jaw longer, growing my jaw wider. None of that actually happened if you look at the before and after photos. And based on everything that I know now, it's just not possible, which is why I'm in the lawsuit. So, these new group of doctors at the Chiari EDS clinic have been really helpful. They are researching condensed oxygen to help me along this stage. They even have some specialized meal replacement, not supplements, but we'll just call them food. Words are not coming so easy to my brain, but it is reassuring because I have done so much. Anyone that's seen my meal plan or my grocery list can understand it takes a lot of work to feed me right now. And I'm hoping that this will make things even easier and also decrease the symptoms that I have from eating food and allow me to eat more, honestly, because the last time that I had that throat surgery, I got down to like 96 pounds. Right now, I am probably 116. And that's my normal average weight. So, give or take muscle, whatever. So, I'll take care of my neck, which if I would have figured this out years ago, it probably wouldn't get to the point where it wouldn't have gotten to the point where I need surgery. But I have just decreased in functioning so much after my last not my last hospitalization, but after the last time that I was really bad with the infection, I still haven't been able to lie on my back. So any amount of better will be worth it in my mind. And there's a 7% chance that things can get really fucked up. My stepmom is my power of attorney, and I yelled at her yesterday jokingly, like, pull the plug. Pull the damn plug if things go wrong. Because I do not want to wind up like Whitney Defoe. I don't want to be on a feeding tube. I don't want to be unable to move or talk. I have done a fucking awesome job of fighting this. I want to continue to fight this, but if I get to that point, I have suffered enough, honestly. And a lot of that has to do with the incompetence, ignorance of the doctors. So, yeah, that's that. I am dating. Oh my god. Not the person that I told everybody about, but I am just sort of more open right now. That's all I'll say about that. I also have my aide that was in computer science, she happenstance. Amazing things like this always happen, and this is why I say I'm lucky, and this is why I say no one should feel bad for me. Um, she graduated in December. She lives 10 minutes from the hospital. So she'll be there to do food or anything that I need in that area, and she's driving me, dropping me off at the hospital. I have a good friend coming to pick me up because pre-op is a day before the surgery. So everything has fallen into place, and I feel good going into it. That aide has also continued to work for me on the Caregiver App. So we're overhauling the Dark is Light website. I'm embarrassed of its current state because I haven't been able to touch it in so long, but I've kept paying for it because it's been a goal to update it. And now she's not only going to update the pages that are there, but we're going to have a progressive website so that people can load it onto their phones as if it was an app. And anyone that wants to help me can sort of have the training and everything right in their hand. It'll be a checklist, it'll be automatic reminders, it will help me with payments, it will help me with my medication. All of the apps that are available right now don't conform to the way that I live my life. I don't like taking medicine, and there's a lot of medicines that I only take as needed. And then from there, they have to be a certain amount of time spaced out versus the other medications that have to be 2 hours from this. It's a complicated algorithm. So I will have that ability in my fingertips soon. The idea is to save me energy because, especially with the home aid profession, there's a lot of turnover to begin with. The cycle of poverty within that profession, because they are so underpaid, is it's depressing. I really feel for the people that have worked with me and their plights, but at the same time, all of their shit gets in the way of being able to properly take care of someone like me. And even if it's a loved one trying to take care of you, this will be something that can cut down on the miscommunications. Right now I'm just talking, not really thinking. I have notes from my emails. Jen and Kerrie, I'm getting back to you now. But it's hard to have a conversation. It's especially hard to explain something and try to come up with words when I'm telling someone where something is or how the process of something, these words are not a real sentence, but how the process gets done. So it'll be levels of training, because it's a rhythm. It's very repetitive once you figure out the details, but it's very detailed, so it's hard to learn. And the Breathe to Sleep organization that I co-founded is still going slow but steady. A lot of us are in active treatment right now, so we will be much stronger once we get to the other side of that, and it's just a matter of being patient. I need, especially right now, some help with the website. We have a WordPress template, and we just need help uploading the content, refining the content, and visually launching the website. So anyone, hi, that wants to assist us, if in any way beyond the website, if there's anything that anyone can do to um, help me get that off the ground more, we are pretty much set with our first letter campaign. We just need the platform to launch it. And by the way, Discord friends, my account was deleted. I got booted from Discord. I did not do anything illegal, but it was against the terms of services adjacent, we'll say. I was basically in a medicine server, and the reason that I was is because I'm really interested in the buyers clubs that AIDS patients did in the 80s. And funny enough, this new mast cell doctor is doing blood work on me because she's pretty sure I have the C4 T cell component that AIDS patients do, just without having AIDS or HIV. So it's a similar struggle, you know, this viral infection bomb that goes off. And I have been really active in talking with my representatives about the bills that could help people like me, because we're so underserved and we're made to feel like we're crazy. And if I didn't have such strong women in my life beyond my family, you know, even the companies that I worked for and my bosses, I would not have been able to, and my education, you know, I have a master's degree, 2 undergraduate degrees, and it's still been a huge struggle to fight against the current healthcare system. So I don't even know where I was going with that. But so I did get my senator to co-sign a bill that is trying to put ME/CFS as a diagnosis into the public health outline, let's say. So it is basically exactly like long COVID, you know. These people that don't get over long COVID are ultimately probably going to be diagnosed with ME/CFS. So that is a huge bump for our potential, research potential, funding potential, all that sort of stuff. And it's been abuse. You know, the medical system has abused me, seriously. So that's my update, I guess. And now I want to reply to my lovely, wonderful friends, because I did not, I've been, my brain has been all over the place, and the physical therapy I'm doing 5 times a week to strengthen above and below where I'm having the surgery, which will decrease the likelihood that I will need surgery as a result of like a domino effect. So things are moving on my upper spine, and it could reverberate further down, fuck things up, and then I would need more surgery. So I'm trying to prevent that. Of course, the more muscle that you're able to build up before surgery, the better recovery will be. And it'll be about an 8-inch opening in the back of my head, because I am at a higher risk of infection and wound healing issues. I'll have a plastic surgeon go in. They're actually going to inject Botox in my muscles before they sew me up, because it'll be a spasming issue after we stretch everything out. Maybe they can hit me up a little bit on the other side of my face. I don't know. So anyway, this will be my, is that a J? I don't know. Whatever one looks like a J to you, I can't think in my mind right now, but that's the marker for her to no, Jen. Hi, this is for you. My my London girl. So, yes, more loving in 2022. It's so funny because oops, I'm talking for a long time. Oh, jeez. Okay, you're back. So, uh, Sabia, my lovely friend, one of my best friends in Switzerland, talked to me about this Celtic tradition. So on Christmas Day, you write down 13 wishes like this, fold them up, and then every day you burn one. And when you get to the last one, that is your wish for the coming year. That's what you focus on. So last year was completed and successful oral health, and that would align my gut, my jaw, my teeth, and my nerves. Well, that did not work. But we've come a long way. We've come a very long way. So I did it again this year, and what I ended up with, the one that I ended up with was a loving, understanding, secure, strong, empathetic partner, a true man. So that's what we'll be looking out for in 2022. But also, I just feel so much better going into all of this. I feel like even though the aids are somewhat variable, I've really come into a good support system. I'm at a good understanding with my family about, well, my immediate parents about why I'm going forward with this surgery and the sort of the type of support that I'll need, and friends. I've gotten to a good place with a small group of people that just really reassures me about everything that's going on. And you warm my heart too. Every time I get an email from you, I literally am so happy to read it. And so I can't remember if I talked about this, but in December I was supposed to stay. Oh, geez. I'll just say it again, maybe. In December, I was supposed to stay overnight in the hospital for the pulley test where they put 2 bolts here, and the intracranial pressure test where they put like an AV cable right here. I looked like a Teletubby. And the results were so bad that from laying down to sitting to standing, that they required I stay in the hospital for 6 days. And I had a blood patch, high volume, 30 cc's of blood from my arm, clotted, stuck into my spinal cord so that it would prevent craniocervical fluid from leaking. I'm not a fan based on the severe side effects that I had. And what we're thinking now is that the issue that I'm having in my neck is creating a dam so that my brain has a really low intracranial pressure, and then my spine is too high. So we will readdress that once I have the Craniocervical Fusion, and we'll see. I don't know what I did. So, okay, so from there we'll see what needs to happen. Do I need to take the toothpick out of my neck, the Eagle syndrome, the ossified styloid? Do I need a different kind of blood patch? It's called a glue patch. Do I need a tethered cord intervention? Do I need the more sleep apnea, UARS intervention? I definitely need implants because I still have the 3 blank spaces from the root canals. And the ocean again, yes. So it was Oceanside, Long Island, and I agree with you. those Indonesia memories. It feels like when I think about that warung that we met, we were both sitting at tables next to each other. I can't remember who first started talking to who, but just in that sunshine, I see us at that table with like a halo, a big circle of light around us. I just, it felt so good and so natural. It felt like I'd known you for so long. And then after that, we just wound up passing each other on the street right by the temple. Whatever that main road was. Jalan Jalan. So, yeah, that all of, I feel lucky. You know, I quit my job because doctors were telling me nothing was wrong with me. And that's why I went to Asia with no plan. And although, yes, I technically got worse because of the what I was exposing myself to, the kind of local food that I was eating, and then the mosquito bite. But it also really prepared me with memories and that deep internal connection that I fostered by being there all alone and walking the island of Gili Meno every morning, just playing with my hands and the energy between them, and really getting into touch with myself. It's been an amazing eternal source of strength through all of this. And it's funny, you know, I'm in my own world. So, yes, things are crazy in New York City, but I forgot. You know, I was even talking to someone that I guess I'm technically dating, and uh, mentioned, you know, like, oh, Lincoln Center and yada yada. I can't wait to go when after surgery. And he reminded me, like, New York City is shut down to you. Um, I don't have the vaccine. I'm not planning on getting vaccinated. My doctors agree that I should not get vaccinated. There's just too much going on right now, and there's about 20% of people just with ME, not with everything else that I have going on, have gotten much worse since the vaccine. And I can't alter my timeline. You know, it's not imperative that I have this surgery for my spine, but if I wait, things will only get marginally better with the conservative tactics that we can take. And um, I'll have to go through that invasive testing where it's just like surgery. You have to go through, it was about 2 months of weekly testing that I had to do just to get approved to have those two testings done. And that will have to happen at least once a year. And it's just, it doesn't make sense. Get it done now. The younger that you are, the younger you are, the better you recover with surgery. Um, we've seen how infection can just wipe me on my fucking ass. So yeah, we're going for it. And after that, you know, we'll see. I also think I might have had COVID after my hospital stay in December when things were just flaring back up again. So I wrote 1 out and 2 in. I don't know what part of your email I was responding to there. But yeah, who the hell knows? You said fall 2022. Okay, I can see myself in London visiting you, visiting my friend Kevin and his husband Anthony, and maybe we'll even meet in Africa. I don't know if you remembered us talking about that. You said you wanted to go back. There was some stuff that you hadn't done yet, and I still haven't been able to go. I haven't touched down on that continent yet. And then of course I have my 10-year visa to India. I had my ticket. I was all packed, and that's when, thank goodness, I went to say goodbye to my friend Marissa, who's an esthetician, and looked at my face and said, "That's not a pimple. That's that's an abscess. You need emergency root canal surgery, extraction surgery. So, and then I wrote, love the questions more than imagine. I have no idea what part of your email I'm referring to either. So I'll look at it again and I'll send you a message. That'll be quick. Um, so, root canals. If you have a root canal, I would recommend extracting it. The issue is that there are so many tubules in your tooth that it's impossible once it's infected to get out all of the infection. Also, quite often, endodontists will miss a root, which is what happened in my case. So sometimes there's 3 roots, sometimes there are 4, and missing a root essentially means that they just left a whole shit ton of bad bacteria in your tooth, and then it just sits there in this little pocket until, like with me, it erupted, and then it is systemic. It goes everywhere. And the health of your mouth is a big reflection of the health of the rest of your body, especially your intestines and your urinary tract. You know, it's all connected. I mean, and that's probably the biggest thing that I've learned throughout this whole ordeal is how interconnected everything is, not just in your body, but everywhere, everything. So, yeah, and I am happy. I'm really happy. I think some people have to stay away from me because they can't connect that in their minds. They look at me and they see the limitations that I have, and it's like, how are you not depressed? But I'm really lucky because I've been able to use resiliency practices, and there's just some sort of internal drive that I have that has taken all of this and seen the lesson in it, and identified the work that I need to do, the work that has been done up until this point. So, yeah, I hope you're happy too. And I can't wait for my next letter from you. And now, how do we make a K? K. Kerrie. So, and oh, okay, so this like kind of loops back to what I was saying before, like, don't feel sorry for me, but you are still sorry about what I'm going through. And yeah, it's hard to be around me because I'm going through so much and because there's a lot of scary shit happening, but I'm not scared. And I joked to my stepmom the other day, yelling at her, like, if things go bad, because there's a 7% chance that, like, I can get more fucked up, I could die, whatever. Pull the plug! I don't want to wind up like Whitney Dafoe. I don't want to be on a feeding tube. I don't want to be unable to move or talk. I have done a hell of a job fighting against the system and making changes and educating people, and I am not scared of what's on the other side. I think that will be a freeing experience more than anything else. I won't have to deal with this pain by the time I'm trying to fall asleep at night. It is intense and extreme, and my whole body will jerk, and the shooting pain is just unbearable at times. So yeah, I if things get worse, I don't want to suffer anymore. And I finally think that we're at the root of things. You know, it was like an onion, uncovering the root canal problems, and then uncovering the sleep apnea, and then uncovering the neurological issues. It's just been one thing after another, the infections, the histamines, blah, blah, blah. So I feel good about everything, and I don't want to be an inspiration. I just, I This is all just happening to me. I don't have a choice. And I know, yes, I have a choice in how I handle these things, but it doesn't really feel like that inside to me. So, yeah. 25 years. Holy shit. That's amazing. Congratulations, by the way. And I totally understand what you mean by the cycle of craziness or being super busy at work. Everything's understaffed now. It's amazing. But I look back so fondly on my time there, you know? And I was so young, right out of college, so um, staying at work until midnight, getting ready for a big pitch. I was lucky, I think, coming into the department when I did, because you guys needed people to expand, and doing all of those pitches and new business work. It was really exciting for me, and I think helped lay the groundwork for what I think my career will be in the future. And uh, the meals that we all shared, and the car services, and then of course, you know, all of the reps going to Le Cirque or going to see the Book of Mormon, and all of the dinners and the massages. It was a fun time. I loved it. And Keisha's back. Oh my goodness. Once I'm better, I'm coming there, and we're doing a big room reenactment on a Friday, and we're having our Friday morning song, because I love how many people are still there. And we'll call Leanna in. We'll get out John. That would be a really fun reunion. And things like that are what I look forward to. I mean, of course, most of all, my nephews and my niece actually just had a baby. So I'm doing this for them first and foremost, but also these ideas of reuniting the parts of my past that make me smile and that have helped me hold on for so long. That's a big source of strength too. So I'm so happy about your new place and accepting where you are with you know who. It seems like, not that this has been a good time, but this is all working out for you well, and that makes me so happy to hear. And resign that church post in 2022. Self-care, right? Okay. So I got through it all. It was way too long in 2 videos, and I said a lot, and probably not all of it made sense, but that is my update. And I will update you lovely friends. Oh, sorry. Okay, so we'll make another sign so that I have an easy damn it, I should have said this in the beginning. I need help, my New York friends. So the surgery is estimated I'll be in the hospital in Oceanside for about 12 days. And then after that, I may have to go to rehab at one of their Manhattan facilities. So I'm not sure exactly what I'll need yet, but basically I am going to need advocates, I think. Advocates and food. So people that are willing to stop by, I'll make a list of days so I don't have too many visitors. In the beginning of December, the rules were that I could have 2 visitors a day, and you just have to wear a mask. There's no checking of vaccination or anything like that at the site. And the hours are 8 a.m. to 10 p.m., visiting hours. However, the person that I was with, there's so many nicknames that I could go with right now, but anyway, they didn't enforce that at all. So one day I had 3 visitors altogether, and every night he was able to stay there past 10. So I don't think they enforce it too much, but coming and making sure that I have I'm going to be writing down the things that I'm needing and asking the nurses for. And then I just need to make sure that I have someone advocating for me. Like, for example, it's always really hard to get bathed in the hospital. And, I live with the dramatic pressure changes in my spine every day. So I know how to get up and walk around and do everything slowly, etc. But they don't allow that in the hospital because my blood pressure is too low and my intracranial pressure is too variable. I get this freaking 10 alarm bell that goes off every time I move to the edge of my bed. And they don't even want me getting into a potty by myself, let alone going to the bathroom, let alone taking a shower. So I'm really restricted. And it's, I get really anxious being stuck in the hospital. I had like almost a panic attack the night before, um, partially because of the person who was supposed to be helping me, but also just because I had this feeling that I was going in for one night and I was going to get stuck there. And that's exactly what happened. And you can't open the windows, and you can't go outside, and you can't even move from the bed. So it feels like a real prison. And with all of the nurses being so understaffed, it's a crapshoot. If they like you, they'll help you more. If they don't like you, they'll lie to you and say yeah, 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 or just be flat out mean. I mean, that's happened. So, just checking in quickly, um, making sure there's things on my list that are being addressed. Maybe going to talk to the nurse for me, something like that, or bringing me food. I'm not so sure about that because my mast cell doctor has these certain meal plans, so I might just be able to have those on special order, or because she's the doctor, she might be able to work with the nursing team to keep things in the refrigerator or whatever. But if not, I'll be going through my meal plan, and Hibba will be helping me, my aide that graduated, that lives down there now. But I might need some more help because, the shit's fucking expensive. And these doctors don't take Medicaid. So I don't even know how much I'll be wind up paying by the end of all of this, but it doesn't matter because it's worth it. It's my health. So, yeah, there'll be a stint in Oceanside. There'll probably be a stint in Manhattan, but they can't tell me which location. It all depends on availability and my insurance. And so this is my plea for assistance. So if you even think that you can come one day to check on me, please reach out to me and let me know. And then I will form a plan from there. Maybe it's someone coming every other day, what have you. And that's it. That's it. I'm doing good. I know you're my friends if you listen through all of this babbling and like ping pong because my brain is not able to consolidate things so well. I love you. 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 Thank you. And I feel really good going into all of this. And that's it.